Thank you, Corla. And I just want to, Minister, make a short contribution to this debate, and I suppose put it on the record of the House that I support this public health alcohol bill. I think I don't drink myself, but I do go to pubs and clubs and hotels with friends, and I can have a mineral or a water or whatever. And you know, one thing I see from time to time is the abuse of drink, which is shocking. And I suppose it's at times we as politicians, you know, must stand up and must be brave and must do the right thing. I think it's very noticeable if you go to an A&E at the weekend, if you have a family member in an A&E in any part of the country, what you see late on a Saturday night, late on a Friday night, and much of it down to the absolute abuse of alcohol. And I've witnessed with my own two eyes in recent years. It's what the staff have to go through, doctors, nurses, the ambulance people. It's what families have to go through. I don't know if you ever looked at the family of a young lad or lassie that's called at the hospital when their daughter, their son has suffered, you know, excess alcohol in their system, and it's an issue of life or death. And the worry and stress and distress that's caused to those people is shocking. And abuse of alcohol causes accidents. It causes broken families all over the place. People talk about shortage of money and not able to pay a mortgage, breaking up families, and it does. But in my view, the abuse of alcohol has done horrendous damage to families in this country. Violence, poverty. Often people that are well paid, much of their money goes in alcohol. And if they have a family, that leads to poverty for that family. Ill health, huge issue. And I've spoken to consultants and doctors, some of them have spoken to me about supporting this bill. And they will tell you that the abuse of alcohol is causing millions to the health service. So we have to take that into account. But most of all, it's the worry and distress and stress that's caused to families. So that's why I support the bill. Just before I conclude, there are one or two things I would say that we probably do need to be careful of. We're giving support to breweries in this country, and I think we've all acknowledged that these are lovely little businesses. But I spoke to a man in Lanesborough, County Longford, who's developing a brewery there at the moment, and he hopes to bring 25,000 visitors to that village if he gets this brewery up and running. And I think it's a matter of fact it does happen, because breweries are an interesting place in terms of a story being told. And Locke's Distillery in Kilbeggan, I think, brings 70,000 people a year to it. And it's a beautiful story to go to Locke's, to have that story, to have the experience of it. Now, in some regard, I think breweries need a little bit of attention here to what they're saying. And, you know, I partly agree with Deputy Aylward here, you know, using the word cancer on the bottles. And look, abuse of alcohol will cause cancer, but abuse of certain foods will also cause cancer. And I suggest, Minister, that maybe we could look at a label like, you know, abuse of alcohol causes ill health. You know, and I think people in the business wouldn't, you know, be against that. We have people in various parts of rural Ireland who are developing breweries and the story around them. And I think they will be good for tourism. And maybe some of this proposal of the label and proposal in relation to advertising could affect them. So maybe in relation to that, take that into account. But overall, I feel it's my duty to be upfront on this and say, I actually want to support this bill, but those one or two reservations I would like to see addressed. Thank you, Minister. Thank you, Ken Corley.